We've talked a lot about iron overload and transplantation, and the question is something important when we talk about outcome after transplantation. There's a bit of controversy on this point, as there was initial data showing that you have a correlation of iron overload and serum ferritin with non-relapse mortality in the transplant settings. More recent studies and meta-analysis published last year are not showing any real correlation. It can be debated about the kind of readouts that we're using. Do we still using just serum ferritin instead of MRI to clearly evaluate iron overload? And most of these studies have been done with serum ferritin or only low number of patients with MRIs. So we should look at this paper with caution. And we also need to think that some of these transplant papers are not focused on acute myeloid leukemia or myelodysplastic syndromes. And this is important, I think, because we know that at least in the myeloid settings, the iron overload can have some impact on leukemic stem cells and leukemic progenitors, as well as normal progenitors. So it's kind of important. On the other hand, we need to think that iron overload is related to high transfusion burden. That high transfusion burden is usually a surrogate marker of more aggressive disease. And so maybe what has been shown in the first study was this correlation of high-risk disease, high transfusion, and bad outcome after transplantation. It's true that looking on not just on overall survival, but just disease-related, disease-free survival and more transplant-related non-relapse mortality is a good way to decipher what's the exact impact or meaning of this high serum ferritin. But clearly, for the moment, we don't have any straightforward answer saying that we have a correlation. Nevertheless, most of the people are considering iron chelation therapy and iron overload before transplantation. Even if it's not maybe on the top of the list, it should be something considered for transplantation, and maybe some intervention before transplantation and after transplantation may have some impact on the outcome. We talk about the risk of non-relapse mortality, but what does it mean, in fact? There's a whole story between iron and infection, and it seems that in the first study that has been published that there was a small increase of infection and with iron overload after transplantation. However, as I previously said, the link is still to be confirmed, and not all studies are agreeing on this risk. Another important question when we talk about non-relapse mortality is the risk of veno-occlusive disease, which is not all the daily patients that will have veno-occlusive disease, but is something that may be really a big problem when it happens. And some studies showed weak correlation with risk of VOD and iron overload, which makes sense when we think about the hepatic consequences of iron overload. But still there, no strong evidence, but just a gut feeling for some, at least some studies.